Welcome to Beyond the Press Release, our production of Gore column in which we take the time to speak with small cap executives after they put out important news. And this news is Texas big, all right? It's from Bloom Health Partners, Trades in Canada, BLMH, for our friends in the US, BLMHF, and for our friends in Europe on Frankfurt under D84. Andrew Morton, CEO of the company, is on the screen with us. For those who are new to the story, before we start talking to Andrew, you may have seen this contract with the state of Texas. Here's what you need to know about Bloom, okay? They're a trusted, and there's a reason I'm saying that, occupational health and safety service provider offering a network of top healthcare professionals, integrated labs for Fortune 500 companies, Hollywood productions, and major sporting and music events. More than just lip service, the contract that we're talking about today, the press release, Bloom Health Partners announces contract with the state of Texas for K-12 schools. It's for testing the remainder of the 2022 school year. So that's quite a number of months in front of us. It's going to include rapid lab testing, and the RT-PCR testing is going to be conducted in Bloom's Dallas lab. It's big. It's Texas big. Andrew, welcome back.
Hey, great to be back, George. Thanks for having me.
Hey, congratulations on this. My Dallas Cowboys lost on Sunday, so that put me into a bummer. But this has been a pick-me-up. Something great has come out of Texas. How big is this deal, first of all, from a third-party validation point of view?
Well, you say Texas big, I mean, you're not kidding. It's a massive state with, I think, roughly 29 million people across the state. Now, I think there's roughly 1,700 schools this covers, more or less. It could be, plus or minus, but that's still an incredible amount of schools with a huge student population. The overall program is a $10 billion program sponsored by the federal U.S. government. This is for states across the United States. So we've got Texas. We announced back in November that we've also won a contract with the state of Alabama. So we're now doing testing both in the state of Alabama under this program and now also in Texas. So, a big state and now a really big state.
Well, this is pretty broad-based, right, in terms of what you're doing, but we know there are specifics. How is this going to work? Because, like I said, it's a big state. There are, 1,700 schools, I think you just said. How's it going to work when you start rolling this out? How do you reach George, the principal at Lincoln High or in Dallas, Fort Worth, or some part of Texas? Explain that to us so that we see how you guys are going to monetize this.
Absolutely. Programs are already underway. So we've already started rolling this out. So we did a launch with the Texas State. If anybody's curious about our training materials for the TEA, Texas Education Administration, you can go to the YouTube page that they have. They have their own YouTube site, Texas Education Administration, TEA. It's a bit of a mouthful. And there you'll see our team training everybody. That was day one. And in fact, even though that was day one, we'd already received inbound calls. So the outreach is quite limited because there's a real need for this. And
so you've already hit the ground running. Sometimes we hear about these things, but it takes weeks, sometimes months to get it going. You've already started, and you're saying that you're already getting inbound calls?
Already getting inbound calls and already working on tests with schools. So there's already children, probably as we sit here today on a Friday morning, being tested in Texas schools. Now, there's two ways we're testing. One is the RT-PCR, like you said. So we've got a nice lab that we've developed in Dallas. We announced that a while back. That high capacity facility is capable of handling all the inbound samples. So we have collectors who can go out and collect. If the schools want to collect themselves, we have kits that they can put them into, and they very quickly get processed. And that evening that they arrived in, they get resulted. So right away, students and parents and all know the results, as do the schools, which is pretty important. On the self-test side, we're sending them kits that they can do self-test with. And that's, in many cases, the school nurses will do it for the children, depending on the age groups. Okay. But what's valuable there is that it's not about us selling kits so much as us actually taking the results and helping them with our digital platform to manage the results. So the idea behind this is now the schools will always know, and on generally a 24-hour to 48-hour cycle tops, the absolute working condition of their student population that participates. And all of this is voluntary. Nobody is making children do this. There's no forced thing here. Parents have to consent. So this whole thing kicks off with a digital or paper consent form that's the parent or the guardian's responsibility to sign. Once they do that, then the child gets tested.
Do you anticipate that you are going to make outbound calls though? Because you can't get, so the start from what you're telling me, that's a fantastic start. And digital, obviously we're Gorecom, we fully embrace and love digital, and you do too. But do you anticipate at some point creating an outbound system, having an internal sales team or an outsourced marketing team that's reaching out to all the schools and doing all the work that usually you need to do in a sales cycle?
Well, we already have a very capable sales and business development team, but what I can say is that team hasn't been deployed here yet because there's been no real need yet. There's been so much demand in this. And what I never anticipated was Omicron, and I don't think anybody anticipated the impact of Omicron. And it's funny, we are very much an occupational health business, or what I like to call operational health. We're working with companies now, helping them stay functioning well beyond COVID type matters. I mean, COVID is a very important thing, and it's not going to go away from the looks of things. George, gosh, 6 months ago, if you asked me, I would have told you 2022, we're going to be on to something else 100%.
Yeah,
really,
all of us did.
This is just part of our services now. And the reason why we won this is our capabilities to be able to deploy quickly. The same things we did in the state of Alabama. Frankly, we got the call in August of this last year, 21. By September, we already had a team on the ground and we had a building staged. And right now we've got, well over 100 people now combing the state daily, going to schools as scheduled to do collections. We're taking exactly the same ground game in Texas. So we took a page out of our already written book on how to do this.
So you got Alabama in November. You announced Texas now. One sometimes is, hey, Andrew, somebody in the team knew somebody, but two, it means you guys are really starting to establish a pattern. Do you guys expect, should we be expecting more states coming on in the coming weeks, months, or the rest of the year?
Our focus has always been Fortune 500 and doing occupational health. But as these folks come to us, I will take a very good look at it, and we'll respond when they come to us if we can deliver. Texas, we can absolutely deliver because we're in state. We also opened labs in New York very recently. We've expanded our facilities in Georgia. So we've now got capacity, and there are more labs coming behind that. As far as more schools, it really depends on what the needs are going to be across the United States. I mean, there are $10 billion being allocated by the U.S. federal government for a program. We're participating in two of the busiest states for that, which is, it's a great place to be. And it also proves that we're very serious about our science, and it proves that we're not just making this up. We've got a very strong team. And if you look at our board of directors, we've got the chief medical officer from GE, the former chief digital officer from Bayer, one of the former CIOs from GlaxoSmithKline. That's a pretty serious group around the medical side. They're going to make sure that we're scaling responsibly. It's a very, if nothing, we have a very serious science background. Myself, because I have a digital background, I recognize the need to do this intelligently. So it's more than just, swabs and collecting samples and all of that, but a really solid digital ground game. So our team's well organized, and more importantly, the schools understand the intelligence behind this. How do they plan around events if there is another Omicron type event?
And is that your differentiator? Because I was going to say devil's advocate. I was going to say, look, before you guys announced the deal with Texas, I'm assuming somebody else was there, doing a lot of testing and getting a lot of this work done. So you're probably going up against at least a couple of incumbents. How are you guys differentiating to the point that you're getting all this inbound calling? Because there's a reason why George was there maybe in 2021, George Calm testing labs, and now you're getting significant inbound to Bloom. What's the differentiator that the schools are recognizing?
I think it's the intelligence, and I say intelligence meaning the data platform. I think it's all about how we organize ourselves and how we manage results, and then how we manage statistics for them. Because for them, it's all about planning. If you just throw volume at a problem, it's not going to fix the problem. If you throw intelligence, start working smarter. I mean, it's a bit of a cliche to start working smarter, but it's very real in a case like this. You've got a situation where, Omicron is everywhere. Thank goodness it's not nearly as severe as the last couple of waves of this pandemic. Who knows what's coming next? But the idea behind this is to add some intelligence to this so they can start planning ahead. So when the next one of these comes, if it does, now the state's ready. They can look at patterns in terms of how students get infected, how they interact, what happens when they close schools, and heaven forbid they close more schools. But luckily they haven't had to do that so far. And if we can keep the schools open, then we've proven our worth here.
So fair to say, Andrew, that the incumbents were more, are just running cookie cutters, test results, whereas you guys have added this great data and intelligence layer, adding, contextualizing everything, and that's become the differentiator.
It's a big part of it. Look, the same principles are taken from occupational health. In the operational health side, which I call it, operational health is really about keeping companies running. And it goes to me well beyond pandemic type situations, because in general, companies are trying to figure out longer term. Number one, how do I attract employees and get them to come here? Because as you know, the great resignation is very real. hard to find good workers. Second part is healthcare costs are increasing like crazy, both in the primary care, but also just insurance in the United States, which is very high. So if companies can use a tool like an on-site clinic to do things like attract employees by saying, hey, we've got a better package for you as an employee. Here is your salary, but then here's also a much better healthcare plan than you're going to find anywhere else. Well, then suddenly that employer now has a card to play against other would-be employers of the same employee that they're targeting. It very much is a seller's market in the job market today. And I know that as an employer. Luckily, we're an exciting.
We're hearing that everywhere, that employees are saying, you need to really woo me here because I've got multiple offers.
100%. So now employers are coming back to us and saying to us as our clients, you did such a good job helping us with testing. We want you to layer that inside services of a broader health care model for our employees. And if we use our data platform as part of that, now they can plan and use the data collected on site, not on individuals, but just as a statistical basis. How many diabetics do we have on site? So now you understand how much longer your staff's going to be there before there were serious health problems, or how often have been tested for certain types of cancers, or what's the health and wellness or the mental wellness of employees? Because PTSD after this pandemic and lockdown is something nobody's really talking about. That's going to be a pivotal thing in the workplace to keep a happy workforce around.
And that's something that a lot of small cap investors aren't used to, because we're used to hearing about how many, listen, we know a ton of companies try to jump on this wave to say, we're going to be providing COVID testing. And
Sure.
A couple have done a really great job, a really fantastic job. Most forget it. But you guys, it's important for them to realize you're not COVID testing. That's one part. You guys are, and I'm going to quote here, you want to become, and you are becoming, a trusted occupational health and safety service provider. Essentially, I know you talk about that just in your last answer, but I want to make sure we put emphasis on this. Essentially, you're coming to a Agoracom and saying, George, look, you guys want to focus on doing what you do digitally and run your core operation. Let us become your outsourced health and safety provider. That way we do it really, really well. You don't have to think about it. You don't have to try and hire someone and hope they do good. You don't have to make any real decision. Is that the big differentiator with of Bloom versus the rest of the small cap space, that you guys are this really all-encompassing outsourced partner for the biggest companies in the world?
Absolutely. We do have excellent Fortune 500 relationships. We're also working with very large film and TV productions, but they're telling us now, COVID's great, like you said, but there's a bigger picture here. Longer term, number one, how do we attract employees to our company? That's the first thing they say to us. One Fortune 500 CEO said to me flat out, my biggest problem, to quote him, and I can't name him without his permission, his biggest competition right now for employees is Amazon. In his factories, because this is industrial, very large U.S. industrial company that operates in multiple cities. In every major operation that they have, down the street somewhere, there's an Amazon facility offering $18 an hour and free healthcare. So in the United States, this is the dream package for an American worker, realistically. So for that employer, he can't compete with the unlimited spend on health insurance. So by offering occupational health on site, now he can say to the employee, I have a better package for you. And if you're a seasonal worker, and seasonal workers don't necessarily qualify for the health insurance package, you get those too. You get the same perks because they're sitting here on site. Part of the deal is now you've got to every quarter or every half run a certain number of tests depending on your health condition. If you're diabetic, that's fine. As long as you come in and you check your status with us once in a while. Now the employer knows what the health and safety situation is. So what have they done by this? They've achieved the ability to attract an employee, which is a major thing for an employer in the United States right now. It's a very topical thing in the HR world. The next thing they can do, because they have all this data that's been taken from all the occupational health clinics on site, is now they understand exactly how many diabetics they have or how many folks have been tested lately for some kind of condition. And then the idea behind that is now they can take that data and turn around to the insurance provider and state, here's the working condition of my exact demographic inside my factory. Forget about the national stats, a male or female, 45 years old, lives in a certain type of neighborhood, makes a certain type of living. That stuff is really great for statistical data. Here's factual data. Here's exactly what's inside the healthcare plan. Now they can really negotiate for better healthcare rates. So the net effect is the company spends less, they attract employees, and they can predict how long that employee is going to stay with them.
Better data means better decisions, better outcomes. Bottom line. How's the outreach going since we last spoke in November? with the Fortune 500 outreach, with film and TV production. What can you give us an idea? I know you can't tell us specifics, but can you give us an idea of how the response has been coming in? Is it as expected, better than expected, maybe worse than expected? And how's the pipeline looking in terms of potentially closing more and more of these big enterprises in the coming quarter?
Very strong pipeline. The announcements we made in the last couple of months around new facilities in New York, New Jersey area, expansion in Atlanta, Georgia, Montgomery, Alabama, Dallas, Texas, and soon to be some other locations is a direct result of the opportunities that have come to us. So our pipeline looks quite full.
Okay, so I want to drill down a little bit on that because it sounds like almost like maybe you can talk about it, but I'm going to ask, and if you can't, just tell me you can't. But it sounds like what you're saying is Georgecom, Fortune 500 company or a big film and TV production company is saying, Andrew, we like what you guys are doing. We need you to have a little more geographical presence so we can really use you because we're a big company. We've got employees all over the country. Is that why this expansion into all these New York and the northeastern region?
Big part of it. Part of it is now we have a system to back up our occupational health efforts. There's also a lot of COVID testing still happening. So as a combination of those two, we can more than justify opening these locations. As you can imagine, operating in New York, New Jersey areas, it can be quite expensive, but the business case is definitely there. The customers are there. This all happened for a reason. We've got clients now already in the New York area and then some of the surrounding states as well as a result of this. And they said to us, you put this here, we'll do business with you. The other part of it is that, at least in the testing side of things, many of our wins tend to be somewhat unglamorous, and like to say that quite tongue in cheek, in that some other lab wasn't quite capable of doing this and they didn't really have the science together, let them down and cause all kinds of problems at a work site or a movie set. We come in and quite often we'll pick up the pieces and really come in and do the right things there. Well, that has also won us a lot of friends in Fortune 500 because they, in many cases, have said to us, that Bloom did such a good job in crisis mode. We'd like to have you here for the next decade operating all of our health problems because we've seen no real movement or changes in the traditional occupational health models we've had for years, vis-a-vis traditional EMT, which is just an emergency station in a factory. Let's expand services and let's take that intelligence to the next level. And that really was what kicked off our occupational health, more or less, almost a year ago when we started thinking about this. And here we are now with a digital platform, clinical capabilities, and a lab network to support it.
And that's the crux of the business model. I think you hit on something there, how companies want you around for the next decade. The one weakness that a lot of other testing focused companies have is, they're bringing in some great revenue. Great. I mean, you can't really complain when you're a small cap company and getting those kind of revenues. That's great. But, you're at risk of that part of the business coming to an end. We thought it was going to come to an end, in the fall. And it may come to an any time, but with Bloom, if you become the occupational health and safety provider to Georgecom Inc., you're there, recurring revenue, you're set for the next 5-10 years.
Nothing we've done in the last 6 months was a result of the next wave coming. We didn't. Who could have predicted Omicron? Like anything else, I'm horrible at predicting the weather. I'm not sure about anybody else. We knew things were happening and it wasn't stopping, and all of our clients are saying the same thing. We need to have testing. But at the same time, I never would have expected this wave. I would have thought at some point it starts to wane, and it's all about occupational health in the future. And here we are now recognizing that testing is probably going to be a big part of our business for a real long time. There's nothing wrong with being part of a testing business, but we're not a COVID company. We're very much an occupational or operational health tech business. And that's what really our focus was from the very start. We got into this recognizing at the very beginning of this pandemic, we weren't here because there's a pandemic. We're here because the pandemic exposed a need in healthcare for extended care.
Andrew, is it fair to say, and I'll end it off with this, is it fair to say that you're going into the strongest position the company has ever been in, like 2022? If you look back 6 months ago, when you made, in the summer when you made the acquisition of Maitri, and you had this big plan and you started deploying it, did you ever think that come January 2022 you'd be this well positioned?
We certainly were planning for it and hoping for it, and we did a lot of work to get us here. These things don't happen by themselves. So this is all a result of a lot of planning. I mean, really what happened when we acquired and made our merger together as teams is Maitri brought a good solid tech platform and backbone and a good team. The Bloom folks brought some clinical expertise. You bring those together, what we have now is a very unique company. And here we are in 2022, looking at some pretty bright days ahead.
Well, congratulations, Andrew. Look, a lot of small cap companies talk the talk. They've got great ideas. They've got a lot of optimism. I mean, you're supposed to be, when you're smart up in a small cap company, that's supposed to come. But on Agoracom, what's so important is third-party validation, walking the walk. And November, you landed Alabama, and now you've landed Texas. So you guys clearly off and running. And I'm hoping this is the first interview in 2022 of many to come, talking about many, many more wins.
Absolutely. Thank you, George. Thanks for having me today.
To everybody at home, you've been watching or you've been listening to my podcast on Spotify, Google, Apple, your favorite podcast platform. To Andrew Morton, he's CEO of Bloom Health Partners, trades in Canada under BLMH. For our friends in the US, BLMHF, and for our friends in Europe on Frankfurt under D84. For those of you new to the story, this is the way you do your due diligence. One, get the company's profile page on Agoracom, where we give you a good 1,000-foot overview, because we know that occupational health and safety is something pretty new to small cap investors. It's been the domain of much, much bigger companies in the past. And then from there, link over to the Bloom website to do your deep dive due diligence, because if you believe in the future, in the rapidly evolving, fast changing future of healthcare providing, then you've got to do your due diligence on Bloom. Just don't tell us we didn't tell you so. Have a great day. See you next time. Hey guys, this video is over, but don't forget to help your company by liking it and even leaving a comment below. And then don't forget to help yourself by subscribing to our channel and never missing another great Agoracom small cap video.